Good afternoon, everyone. Thank you so much for joining today's webinar. My name is Amy Gottrad, and I work in the Nutrition Resource Center at Gordon Food Service. We know that your world is incredibly hectic right now, so our goal is to ensure that this hour away from your growing to-do list is well worth it. And I feel very confident with our guest speaker today, we are going to meet that goal. Before I introduce Catherine, I just have a few quick reminders for the group. Because this is a webinar, you can hear us, however, we cannot hear you. However, I do want you to take advantage of the question box located within your go-to panel to type any questions that you may have during today's webinar. We will be reviewing those and hope to have time to recap and have some question and answer at the end. Today's webinar is being recorded, and today's webinar has been applied for continuing education through the following organizations: the Academy of Nutrition and Dietetics, the Association of Nutrition and Food Service Professionals, and the School Nutrition Association. That CEU certificate will be emailed out to all participants tomorrow, Friday morning. So with that, let's talk about our guest today. We are so excited to have Catherine Fenner with us. As a principal at Technomic, Catherine is responsible for managing and executing strategic research and consulting programs for manufacturers, restaurant operators, and trade associations throughout the food service industry. Catherine has more than 20 years of experience in the food service industry, including food service, vending, and convenience. While Catherine has been part of the Technomic team for more than 8 years, she's also worked for 16 years on food service manufacturing side with marketing, sales, and innovation roles. We are so incredibly fortunate to have Catherine with us today. As you can tell from her background, she brings a wealth of experience and knowledge. As I mentioned, we greatly appreciate you taking the time out for today's webinar. So Catherine is going to start by recapping some of the things that you all as operators have been living day in and day out during this public health crisis. As we know, this has been filled with challenges, learning, and growth. And I do want to thank you all for the support that you've provided as critical members of your healthcare or education operations team. Next, Catherine is going to take a look ahead to the near future. Now, this is where I really encourage you to pause and take a breath, something that I'm sure has not been easy for you to do lately. However, that insight about potential changes or trends that may be coming our way is so important to hear, and use that information in your own planning. And we can learn a lot from one another. So Catherine will be talking both about the healthcare and the education side of the business. And we will be able to learn from both of that, as it provides valuable insight across the non-commercial food service industry as a whole. With that, I will turn it over to Catherine, and I do just want to give one last reminder to please take advantage of that question panel within your go-to panel, so we have time for some Q&A at the end.
Thank you so much, Amy. That was a really nice introduction. And thanks to everyone on the phone for joining us today. My name is Catherine Fenner, and I am a principal at Technomic, and I just got to get everything started here. Here we go. And so I was thrilled when the team asked me to be part of your session today. As mentioned, I'm going to start by talking about where we are now. As you all well know, COVID has really changed not only our lives on a very personal level, but also the way we do business. And so we're going to start by kind of talking where we are now to put some grounding into the discussion, give a backdrop and a comparison point to where we're headed next. We're going to spend most of the time talking about the specific impacts for each of the non-commercial segments. And then we'll also talk about some macro issues that really go across multiple segments and what they could mean for you as an operator. And then finally, we'll focus the back half of our conversation on where we expect to go from here, things you can think about, things you can learn from other operators, and best practices that you can learn from. So with that, let's go right into where we are now. So as you know, stay at home has really forced change across the country. Not only has this new way of living created anxiety and unemployment and changes in the way we interact with each other, but it also means you really have to be very considerate of your employees, protecting their physical as well as their emotional health and their employment, and what's that going to look like going forward. Let's take a look at stay at home, because that really is what's driving so many of the changes currently. And then we know keeping your employees and your visitors safe are what are going to drive changes going forward. So as of May 8th, we see that across the country, we have a mixed bag. We have in the red states, the dine-in is closed still statewide. And that was really the case up until about 2 weeks ago for every single state, with the exception, I believe, of South Dakota. Now we see, however, that states are beginning to reopen. You're beginning to need to think about, if you haven't already in the last few weeks, how you're going to reopen depending on the segment that you're in. We also know, which is going to impact a lot of people on the phone right now or on this webinar, that 39% of people are working from home. Now, that tends to be most common in big cities. It tends to be most common in white-collar jobs. However, it impacts all of us, because all those people working from home means that their patterns have changed. They're not coming into the B&I for lunch, as you well know, or they're not stopping for their cup of coffee. It really is changing a lot about the way various people have to do business and the crowds that you're attracting. And then finally, we're going to talk a lot today about school closures, when they're going to reopen, and what they will look like when they reopen. And in the very beginning of all this, operators were really expected to pivot very quickly. So this chart that you see here combines both restaurants and non-commercial. So it's all types of operators, but this is what operators told us they did in the very early stages. They had to reduce staff, unfortunately, which no one on this webinar will be surprised to hear. In most cases, they either reduced operators or operating hours or closed down altogether. They needed to really bump up their communication so that their customers knew what was open, what wasn't, and what the process was if they were able to still get meals from your operation. And then retraining staff on cleaning and food safety. Those were really the big things that operators have been focused on for the last few weeks. And we've kind of termed this the survival mode, right? That's what everybody's kind of been in the last few weeks. It's this transition now that we're beginning to be in, from survival to sustaining, and then ultimately reaching a successful reopening that we're going to spend most of today talking about. But there's a few things that really we want to bring to your attention, because this is one that's really going to impact all of you, which is self-service taking a hit. So one of the things, not only has dine-in been closed, but even as operations that were able to stay open or are reopening, there have been impacts to self-service within these operations. So the states in red mandated self-service was no longer allowed. The states in yellow recommended a discontinuation of self-service. And even in all those states that are currently pictured in gray, where there's no particular recommendation for self-service, we know consumers are uncomfortable with it. We've done a lot of consumer surveys over the last few weeks. In fact, we've been doing it on a weekly basis so we can monitor how their attitudes are changing. And one thing that really hasn't changed is a discomfort among most consumers with anything that is self-service. They don't necessarily want to touch something that was just touched by all of the other customers that came into the operation. So this is going to impact business campuses, colleges, schools, anything with a salad bar or fountain beverages. If you did hot buffets, if you did hot bars like taco bars, all of these things are going to need to be rethought going forward, not only because of the concern for contamination that you might have as an operator, but because of the concerns that your audience is going to have with those types of service models going forward. So what we see is a very dramatic switch in the last few weeks and a continued expectation of more prepackaged, more grab-and-go items. And we're seeing such, in healthcare, we're seeing more traditional tray lines where they're serving from behind, plexiglass, behind the counter. Expect to see that in other types of operations as well. C&U, B&I, as they reopen. Okay, let's talk specifically about the segments now. So we're going to start with K through 12, and as any K through 12 on the operator or on this call understand, most states have closed their schools for the remainder of the year, and that is what you're seeing in red there. And I should say remainder of the academic year. So the 2019-2020 school year is over for most schools, and so these schools have needed to pivot to supplying emergency feeding instead. We heard stories from schools where they had 2 to 3 days to switch to emergency feeding programs that very much mimicked what they do in summer feeding, but they usually have a lot longer to make that change and make that transition. So I think the overwhelming feeling is people are very impressed with the way that schools have pivoted and met this need. So a few things to talk about. With this switch to these types of programs, we're seeing a lot of staff had to be cut. They're working with skeleton staffs, but at the same time, costs have skyrocketed. So some things that are going on, states are fighting for more funding. The SNA is fighting for more funding for schools to help overcome some of these increased costs that schools are currently feeling. We also see expansion of programs to reach some areas that typically can't do summer feeding or summer feeding type models because the students live too far away from the schools. So there's a Meals to You program that is intended to feed youth in rural communities. They are distributing 5 million meals each week in 35 different states. And so the idea of this program is to provide meals to low-income children in rural communities where logistics don't allow them to come to the school and do the the curbside pickup that so many schools have been able to successfully pivot to. This program was started by Baylor University, and it's a partnership between USDA, McLean Distribution, and so expect to see more programs like this being put into place to ensure that students are needs are being able to be met across the country. We also know that there's around a dozen states so far that have begun participating in pandemic electronic benefit programs. So what these programs are, they provide $5.70 a day to parents of students for families who don't have access to the free meals in some areas. So that's another program for consideration if your area doesn't have the ability to continue feeding emergency need feeding in your area. Let's take a look at some examples of what we see happening based on the current challenges. So as I mentioned, most schools have pivoted to take away family meals and curbside delivery. Let's look at one example here. We've got Jefferson County Public Schools in Louisville, Kentucky. They had a matter of days to switch over to grab-and-go sites and meal delivery. They actually delivered to a lot of families, and I know they're not alone. There are a lot of other schools that are doing that as well. It involved, within a couple of days, not only changing the way they were packaging foods and the types of foods that they are serving, but teaching strict hygiene procedures, which also included zoning. So zoning and shift differentials, meaning we're going to bring in certain people to do certain jobs at certain times, and they're going to work in a certain area, and we're going to try not to have cross-contaminations between the different people. So for example, if someone's working in production, they're going to try not to have a lot of contact with the people who are maybe delivering the food. But there were strict protocols in place for people who did have to have that contact on any cleaning that needed to be done afterwards. So clearly a lot of complication, a lot of challenges in delivering this, but schools, again, have pivoted successfully to doing that. We also see, as I mentioned, a higher degree of packaged single serve. So this is needed for safety reasons, but also for labor savings, because remember, a lot of people aren't able to have their full staff there helping them. So SNA has actually partnered with United Fresh Produce. And what they're doing is they are going around the country and connecting farmers or produce distributors, fresh cut processors. They're connecting those processors with schools in the area who need single serve rather than their usual bulk serving of fruits and vegetables. And they're able to get single serve packaged foods to meet that need by working through SNA and United Fresh Produce Association. We also have heard a lot from schools that we've been talking to about the need for student engagement and family care, that there are so many families who are really struggling right now. So it's really important to keep that community connection going. And so there's a lot of different ways that schools are doing this. First, they're doing things like fun messages on bags. So you see the picture there where the staff is either doing it and putting notes of encouragement on for the students from the families. Maybe they're putting games on the bags for the students, or in some cases they have volunteers coming in to do that very thing, volunteers from high school or college level who are coming in and helping decorate these bags. We hear things like Alva School in Florida. They wanted to keep up interaction and ways to check in with the students and their families. So they created theme weeks for their meal pickup. So for example, they would have a show and tell week, whereas the families came in to pick up their meals for a few days. If the student was with them, they could bring something that from a socially responsible distance, they could tell the staff about that item that they brought for show and tell. So it's another way to engage kids and help them feel connected to the school. We also see things like the Wichita Falls Independent School District. They are making sure to take care of needs for the families beyond just the food that they're providing. They partnered with the Children's Miracle Network to provide a new pair of socks for every meal that was handed out. So schools are recognizing and fulfilling that need for additional community assistance and community connection. So let's talk about some of the things that are likely keeping you up at night. If you're a K-12 operator, we know USDA regulations continue to be a challenge for schools. The School Nutrition Association is attempting to help with that. Just 2 weeks ago, or actually mid-April, the USDA had rolled back a lot of the regulations on sodium and grains. And a court ruled in mid-18 that those rollbacks violated the Administrative Procedure Act, which means they didn't seek the proper public feedback and comment period before rolling out those rollbacks. So they're not allowed at this point to do the rollbacks, the USDA. So SNA is working with the USDA to try and get a reinstatement of that, because in this particular time, it's more challenging than ever to keep students fed. And so putting that extra burden of stricter regulations on grains and sodium, it's just further complicating and challenging for the school districts. So at this point, schools are going to need to plan as though in the fall when they come back, they'll have to continue to meet these stricter regulations. But there is hope that the SNA and USDA will be able to convince legislators to allow them to reinstate those rollbacks going forward, to ease some of the burdens and some of the cost burdens in particular on schools. In the meantime, we do know that there are a lot of, during COVID-19, there are some things available to you. So there are state waivers for COVID-19. So I would, if you haven't already, and I'm sure many of you have, go to fns.usda.gov. That's the Food and Nutrition website where they list for you any state waivers for the USDA regulations during COVID, which are intended and were designed to make it easier to meet the needs in a practical manner for student feeding at this time. Some of the waivers that we've seen out there include things like waivers for more flexible meal times when schools are back in session, waivers to be able to allow you to feed kids in non-group settings, which obviously was necessary for the current emergency curbside pickup style of feeding, waivers for your timing on eligibility. So you have extra time to get paperwork on who is eligible for free and reduced meals. There are waivers for parent pickup, that the students don't need to be with the parents when the foods are picked up. And also a pause on the need for after school feeding. If you're going to be able to provide additional meals beyond breakfast and lunch, you no longer need an enrichment activity to be done at the same time in order to achieve that. So these are a lot of different accommodations that have been made. So definitely check for your state waivers at that website that I mentioned, and then you can click on your state and it'll tell you exactly what waivers are available to you as you prepare for your fall season. Now, a couple other things worth commenting on. There's schools have told us that they're very concerned about USDA commodities next year because, the way it's done now, as you well know, is they use the previous year's counts to determine what your commodities will be for next year. And obviously counts will be off in the existing environment. So there's still some open questions on how that's going to be managed for next year. But the issue has certainly been raised to the USDA. And then next, school lunch debt. A lot of schools are worried about rising school lunch debt and what's going to happen with all the school. We hear so many families newly dealing with unemployment or wage cuts or hour cuts in their jobs, which will only make it harder for many families to pay off school lunch debt or to avoid, new lunch debt. So there's some recent legislation that was proposed to forgive any past lunch debt. So we'll see where that lands. At this point, it's just proposed legislation. There's also proposed legislation by Ilhan Omar and Bernie Sanders to eliminate reduced meals going forward and just have it either be paid meals or free meals, because the belief being that if you eliminate the number of reduced meals, you'll eliminate the potential for school lunch debt, because those children will now just be qualified for the free lunch meals. So, obviously we'll be watching those very closely to see how that will turn out for the fall or beyond. All right, now let's talk about colleges. Colleges, obviously, similar to K through 12, having a lot of challenges with campuses, the vast majority of campuses across the country shutting down for the remainder of the academic year. And there's still a lot of questions as to when they're going to reopen. Now, while a lot of campuses are shut down, there are many campuses that still are feeding a small number of students, so they still have to work through COVID and how to serve during this time. Those students are either international students that couldn't go home, or in some cases, I talked to an operator in California who said they have a significant number of homeless students on their campus and that just don't have a home to go to, so they allow those students to remain in university housing as well. So feeding is still certainly happening. What we see is a variety of different things are happening to do that. Most of the time, these students have been moved into single unit rooms, so there's no ability for them to be with other kids, but they can do curbside pickup types of things for their food. Because they couldn't dine in. And some schools also had already started testing robots on campus. And so those that have those are using those to get to the dorms and feed students. We know during, you've got a picture there of Bowling Green State University, which is managed by Chartwells, and they are using their fleet of 40 robots to deliver not only from the cafeteria, but from on-campus concepts like Dunkin' Donuts, Panda Express, and they're using it outside of the campus to get to some areas in the local community, too. You can see it visiting some first responders there at the fire department. And then there's another example with University of Wisconsin. They also have a fleet of robots that they've been using on their campus as well to feed students that are still on campus. So obviously, if for schools that have that, it's a great solution to low touch delivery or low contact delivery. Not every school has that. So that's where curbside pickup, similar to what we see being done in restaurants, has to be implemented. We also see colleges really jumping in to provide for community assistance. A lot of colleges had food left over, so they're making donations to local charities. We also see them partnering with local YMCAs to provide meals at the local school districts. So we see that in a couple areas. One example is the University of Memphis, where a school was unable to continue doing their own food service because they had some folks that needed to be quarantined due to exposure to coronavirus. So the university jumped in and worked with the local YMCA to provide meals, 8,000 meals a day to school students in the areas. So we certainly see them jumping in and helping in the community. And then we see a lot of colleges that have shut down still trying to maintain connections, much like we saw in K through 12. They want to keep connected to the students and let the students feel connected to their on-campus life at the same time. And we see a variety of different things being done to accomplish this. For example, Princeton is just one of many colleges that is using social media to share recipes that they make on campus so that students can make those same recipes of their favorite college dining items at home. Duke is using Instagram theme weeks. They'll pick a theme of some of the items they do on campus, and they'll post or encourage students to post pictures of what they are eating that meet that theme at home. And then North Carolina State, they are actually encouraging their students to download pictures of campus as backdrops so that they can have virtual lunches with their classmates. Even though they're all separate, they want them to be able to feel like they can sit down and enjoy a meal together, just as if they would do if they were still on campus. When will schools reopen? So most are planning for some variety of in-person campus activity, but you will see many of them are keeping their options open and saying they just don't know enough today to know exactly what it's going to look like. So there's a lot of possibilities that are being discussed. First, de-densified residence halls, so making sure there's only one student per room as an example. Not having the students in close quarters in the residence halls. Next, we see contingency planning. So schools talking about things like instituting red flag or yellow flag days, which would mean today we feel there's a high risk, or this week we feel like there's a high risk of potential exposure to the virus. So this week we're going to modify how the university operates. You may go virtual that week instead of in-person classes, as an example. And the food halls on that week might go to curbside only instead of dine-in. So, colleges are definitely having to think contingency planning. They're talking about staggered class dismissals or, staggered times when you're allowed to go into the food halls so that we don't have as many students crossing paths at the same time. And then we're hearing from some schools that they are considering giving students a choice this fall, a choice of whether or not they want to walk into the classroom with a mask on and attend class, or whether they would prefer to attend that day's lecture virtually. So we certainly see there's a variety of things being considered with no real answers solidified for most schools because it's still an ever-changing situation. So just a couple of things we heard. Harvard will be open, but we are preparing for scenarios for remote learning. University of Oklahoma said our intention is to return to in-person, offering traditional instruction. So there's a school that says business as usual is what they're planning for. And then you've got schools like University of Pittsburgh who are just being very honest and saying back to normal is probably not likely, and we don't even really know what kind of normal we're planning for. So there is a website where you can track what schools are planning for the fall semester. It's called and we got this from the Chronicle of Higher Education, and we check this weekly and update this list. Just 1 week ago, this list was about half this size, with most schools not having made any sort of decision or announcement at all. So we are really entering a time when schools are beginning to much more rapidly announce what their plans are. So obviously this is an eye chart. I don't expect you to read this right now on where different schools fall, but I wanted you to know this resource is available if you want to see what other schools are doing and maybe borrow ideas or learn from some of your colleagues within the industry. The first few rows there are the number of schools who are planning for in-person instruction. So that's the biggest list right now. That doesn't mean they won't still have contingency plans and be limiting the number of students in different places at different times, but they are planning for in-person instruction. Then we've got a list of people who are planning for hybrid, some in person and some online. Then we've got planning entirely online. So we see 4 schools there that have just said we are not opening on campus and it's all going to be online. And then we've got a fairly sizable list of schools that say we haven't made a decision yet. So we'll let you know when we have. So still very much a mixed bag of what we expect to see in the fall. And in a little while, we'll talk some more about what we expect that fall to look like. Now, moving to hospitals, obviously hospitals have had to, in many cases, remove things like room service, the ability to allow that extra level of service and that flexibility in their meal programs has been taken away. They've moved to tray only. It's easier to do safely to minimize the amount of exposure that both patients as well as staff have to the COVID virus. We also, as you well know, if you're a hospital operator on this webinar, we've seen elective procedures halted across all the states. Now there are a few states that have begun to open that up. So you'll start to see slowly more and more hospitals allowing elective procedures again. Once they do that, you're obviously going to have a lot more traffic. And we believe there's certainly pent-up demand for elective procedures. Will consumers come in right away for those? Most likely no, if they can afford to put it off. So those who can put it off will, but there will be some surge in getting those elective procedures scheduled again. For staff and families, we see a lot of hospitals providing staff and family meals. A lot of hospitals were doing this already, but we've certainly seen this area explode. And it's a service to those people who are working so hard, working long hours in the hospitals right now and under very stressful circumstances. And the last thing that they have time or energy for when they get home is cooking. And so they're providing a limited number of staff or family meals each and every day. And they're making sure that they focus on the most popular foods that are going to have the greatest appeal across the board and easy to prep. So not as much variety available, but it's still an important service that most hospitals have begun to offer if they weren't doing it already. And in a lot of cases, we also hear they're allowing the community to donate staff those meals as well. They would prefer that, as you might imagine, to the community donating outside food. So a lot of hospitals are making it possible, whether on their website or elsewhere, to say, yes, I want to provide some staff meals, and it comes in the form of meals prepared at the hospital itself, or these family meals that they can take home, rather than encouraging people to bring food from outside resources, so that the hospital can begin to, work through some of their inventory, as well as make up for some of the lost revenue from not having all those elective procedures going on and that additional traffic. And then we also see hospitals beginning to do a lot more with grocery pantry sales. So selling pantry items that have been very difficult to find at grocery stores, whether it be toilet paper and paper towels or milk and eggs. It could be because they were difficult to find in stores, or it could be because, again, these healthcare workers do not have time to shop. Maybe by the time, they've got long shifts, they don't have the energy. Or maybe it's just that by the time they get off their shift, it's 2:00 in the morning and there's nothing open, or what is open has been picked over for the day and the new shipments haven't come in yet. So that's an important service that a lot of folks are offering. And that's a service that we expect is going to stick after COVID is over. We also see a lot of hospitals saying that they are putting staff in different roles, and I mean food service staff. So while they aren't making as many meals and not doing, inside made-to-order meals in a lot of cases in the cafeteria, they are placing those staffs in different roles. There's a lot more inspection, a lot more sanitizing that is going on than is traditionally necessary, and so those folks have been retrained so that they are still playing a very important role within the hospital food service area. Let's move to nursing homes. The biggest challenge for nursing homes, obviously, is mealtime socialization is not possible. And so residents are eating in their rooms alone, which is difficult emotionally, as well as in some cases physically for some of these residents. Engagement is happening then. They're trying to do some nice things for those residents via special menus, maybe special menu items that they know are favorites among the residents to help boost up their morale a bit. We're seeing a lot of what we saw in K through 12 with adding little notes or fun packaging or pictures to the trays to help lift spirits as well. And obviously staff precautions are most critical in this population because they're so susceptible. So that's where we see a lot of the energy and a lot of the staff being used in nursing homes is on making sure that new procedures and training is put into place and strictly followed. And then like hospitals, we're hearing a lot of nursing homes have started an on-site pantry store for staff, and for the same reasons that hospitals are doing it. It's, after long days and it's very difficult for them to get to the store. And so this is a service that those nursing homes or, senior community centers can provide to their staff. In some cases, they're providing this to the staff free of charge, and in some cases, they're doing it at cost. Now talking about business and industry, we are looking at a pretty bleak employment picture right now, and I know I'm not surprising anyone on the line when I say that. We are seeing numbers as high as 6 million jobless claims, which is obviously much higher than we have seen for a very long time. Now, this goes back to the beginning of the year where we were seeing pretty historically low unemployment numbers, 335,000 claims a week, things like that. We had been at a low for a very long time. So to see them spike in this way is alarming, and then many of you in the business and industry segment are really going to feel that. With lower populations, even if they do open back up their buildings, many of which are still closed. Now, we are not at the total jobs lost in the Great Recession being back in 2009, 2010. But we certainly are at an area of concern. Now, let's look at how this looks across the country, because obviously some states are struggling a lot more than others, and depending on where your location is, you may feel this harder than others. So let's take a look at it, as an example. Texas is looking pretty good. South Dakota is looking pretty good. The lighter the color, the better. Their levels of unemployment are much lower. But then you see some of these other states, whether it be we're looking at Tennessee or Kentucky, Michigan, Georgia. Some of these states are having much higher levels of unemployment claims just since March 21st. So those are the areas, if you're operating in one of those areas, you're going to feel the impact greater than other states will. And as I mentioned earlier, many people continue to work from home, and we're hearing companies, some of them are starting to talk about bringing people back. These are obviously more white-collar jobs, a lot of blue-collar jobs kept in production throughout the last few weeks. But in the white-collar jobs, a lot of offices shut down, and so a lot more people were working from home than we would typically see. So as of April 26th, that number was 30%. And that 23% in red is a number who normally wouldn't be working from home, but was. So obviously, with companies talking about extending work from home, through the summer and even providing flexibility past that, depending whether or not we have a resurgence of the virus in the fall, those numbers could stay that high for the foreseeable future, which obviously is going to impact many business and industry locations. So we see a couple of creative things, though, going on within this segment. The picture you see here is USAA San Antonio headquarters. So Sodexo manages that particular location, and what they have done is piloted a program that they're doing across various locations for USAA of curbside meal pickup for employees and their families. So instead of going to your local restaurant and picking up dinner for the night, you can stop by the USAA headquarters and pick up from the food service staff that are working there. And USAA looks at it as a service they can provide. People don't have to get out of their cars. They're selling at a reasonable price, so it's a good value for the families as well. And their VP of operations said the first time they did this, they received 275 orders in the first day. So families, we're looking forward to taking advantage of this program, and certainly something that could be considered, I think, for other business and industry locations. Locations that remain open are practicing a higher level of social distancing, obviously, with tape on the ground. We're hearing companies talking about inserting plexiglass, which many restaurants are doing, and we're seeing a lot more grab-and-go foods and grab-and-go beverages in particular, and coffee stations and fountain drinks are going by the wayside for the time being in many cases. So let's talk about some macro issues that really impact all of the segments across the board. So the first is labor. So labor, we just talked about how much unemployment there is. Many of you have probably had to furlough workers, and what restaurants who furloughed workers are finding as they're coming back online is that a lot of workers aren't coming back. So there's going to be a challenge of retraining. So why wouldn't employees come back? Well, we've started to do some survey work and some interviews with consumers, and there's a high level of discomfort now in working in food service for two reasons. One, because they don't want to be exposed to the virus, and they feel that that's an industry where they may have a higher level of exposure versus if they were to go into some other types of jobs, such as working in a call center or something like that. And then the second reason being so they don't want the exposure. And then the second reason being that they don't want to be in an industry where they feel it's easier for them to get furloughed. So they feel burnt by getting furloughed this first time, and they're looking for an industry that may be more stable over the next year or two, where they might be less likely to get shut down again or furloughed again should there be a resurgence of the virus. So labor is going to continue to be a challenge. Next, continued investment in off-premise. So we see from consumers that they still have a high degree of discomfort with dining in, even where it's opening up. So we looked at states like Georgia and Texas and, where they're opening up. And sure, there are definitely some people returning to dining rooms, but not nearly to the level that they would typically do or we would have seen pre-COVID. And our data backs that up with most consumers, 58% of consumers saying it'll be more than a month after things open up before they are comfortable in a dine-in environment again, because they're really taking a wait and see attitude. They want to see what happens to the other people who have tried it. Were they safe before they are willing to sit near other people in a restaurant again. So we'll continue to see a much higher degree of people interested in takeout. Whether you're in a hospital or a B&I or a college, expect them to want to do more off-premise. And in K through 12's case, we hear schools considering things like eating in the classroom instead of eating in the lunchroom so that students aren't all together, or doing more variants of mealtime so fewer students are eating at the same time. Decreased emphasis on customization. So over the last few years, thanks to successful chains like Chipotle, we saw a lot more made-to-order customization happening. That's going to take a backseat for a while. Consumers are okay with a lower level of customization and convenience right now if the trade-off is they feel the food is safer. They want to see a higher degree of packaging. They want to see fewer hands touching their food. So there'll be less of a demand in the near term for customization and made to order, which, is really what's going to be needed to keep things low touch. We'll also see continued channel blurring. Customers, consumers, those who have a pantry on site that is available to them to get pantry items, they're loving that convenience, right? Not having to go into the store and potentially exposing them to the virus. But even more than that, think about the convenience, whether you can have it delivered to you from a restaurant or pick it up at work, or at the hospital, if that's where you're working or visiting. Think about the convenience of not having to make a second store stop on your way home if you can get it where you already are. So whether that be your eggs or your milk for the next day. So we expect a lot of operators to continue offering that because consumers are loving that convenience. Reduction or removal of self-service. So I talked about that a little bit. That goes hand in hand with more, less customization, less made to order. People don't want to touch with foods that are more exposed, or they don't want to touch the same spoon to serve themselves that somebody else just touched unless they see it wiped down in between. So where self-service remains, consumers want to see constant wipe down, such as a fountain beverage machine, but even more so, they would prefer to be able to see things like, they would prefer to be able to see a grab-and-go bottle of soda rather than a shared fountain drink. Renewed interest in single-use packaging. So for a while, packaging was evil, and people were less interested in having packaging that was disposable, and especially on college campuses. Colleges were increasingly looking at how can we reduce our single-use packaging. Well, now we're seeing renewed interest, because really consumer motivations are, if you've ever heard of Maslow's hierarchy of needs, the idea is the base level is all about base needs and security. You need to feel safe, and you need to know you have your food coming to you before you can move on to other motivations or other things that you would like to achieve. So some of those other things they want to achieve are things like a more sustainable world, which is great and it's important. But right now, consumers are more focused on safety. They'd rather feel that there were less hands touching their food and that their food was covered so no one could breathe on it or cough on it, et cetera. So expect to see more interest in single-use packaging until COVID-19 fears subside, which could be a few years from now when we have a vaccine. Next, smaller menus. So lower touch and fewer employees and more labor challenges means most operators are going to be looking to streamline their menus and get back to the basics. So less choices, less customization. You still need to offer varieties. Consumers still don't want to eat the same thing every day, but fewer choices per day will make it easier to serve and keep up the heightened hygiene protocols that you will need back of house. Where do we go from here? So we are not going to go back to the pre-COVID world entirely, but we definitely will find a way forward. So let's look at what that looks like. First, staggered openings. Part of the challenge of not knowing what things are going to look like is that we don't have one common rule across the country. So timing and the rules of how you can reopen vary across the U.S., and this chart shows that. from state to state, the rules can be very different. In Alabama, they have a safer at home rule, which meant stay at home if you can, but employers can open up their offices at 50% capacity, and elective medical was allowed. Other places are still closed, or in Florida, retail and restaurants can open, but only at 25% capacity. But outdoor seating can be at 100% capacity. So you really need to, obviously understand your state rules, but also understand that's why there aren't, one size fits all solutions. I mentioned consumers are going to continue to be cautious. And what we see is the longer this COVID-19 stay-at-home ends, the more cautious people are getting. So we started doing this survey in March 22nd, and we've done it as recently as a week ago. And you can see the number of people on the right-hand side of your screen that said it's a month or more after they're allowed to go to restaurants that they will return for dine-in, just keeps going up. So it's going to be a little while before they're comfortable going back to some of their old habits, especially dining in. We've done some scenario planning to understand what we think the overall impact on your segments will be. Obviously, no one's got a crystal ball, but we made some assumptions based on when we thought shelter-in-place orders are going to end, based on an assumed recession for the second half of the year, economic recession, and based on there being a little bit of pent-up demand when things do reopen. So that's the best case outlook, with non-com being down about 15% for the year, total industry higher because restaurants are taking a bigger hit. Worst case, though, assumes another resurgence in the fall of the virus. And so that's where we see non-com, a lot of things having to shut down again and seeing a bigger hit. So here is the by segment look. I'm not going to spend a lot of time on this here, but it varies. Obviously, you can see the worst case scenario can vary from 33% for business and industry to 45% for education if college and universities don't reopen and go to virtual. So what's next for B&I? We'll see an evolution in blue-collar facilities where we're going to see a lot of safe distancing protocols being put into place. They are going to be de-densifying their facilities as much as they can, and personal protection equipment will be a must. A lot of attention in this area thanks to what we've seen happening in meat plants. Where in the food service environment, those plants we already see what they're doing. They're putting very limited seating, so they removed a lot of tables. They're putting separators between the tables or allowing only one person per table, and everybody has to be seated in the facing the same direction. So these are some of the things we've seen be put into place. And then a lot more order ahead where that's feasible, so you're just coming to pick up your food. White collar facility, continuation of work from home for a lot of places. And then once they do come back, they're talking about rotational schedules. So maybe half the people work Monday, Wednesday, and half the people work in the office Thursday, or Tuesday, Thursday, things like that. They're talking about a lot more partitions and much like blue collar is with plexiglass, and maybe limiting break room or cafeteria capacity. And really, 21% of consumers only said that they're ready to go back to the office. So companies are going to be listening to their consumers. They want them to be comfortable coming back, and so there likely will be a delay. So food service traffic will struggle. There's not that ability for people to socialize. They'll be taking their food back to their desk, and they may choose to go elsewhere for their food if they're eating on their own anyways. That reduction of self-serve will absolutely be a concern. So companies will be looking and tell us they're looking at other things like desk delivery, virtual lunch breaks where they can connect with their coworkers, like you can see me now on the screen, and then more of those pantry fill-in and take-home dinner to try and make up for the lack of food service traffic. Next, in K through 12, we see the schools are looking at things like meals in the classroom, as I mentioned, definitely limiting or eliminating the food bars that we had previously seen, whether that be a salad bar or make your own taco bar, make your own sandwich bar. They're also talking about things like shorter days. So maybe school is only in session for half the students from 8 to 12 and the other students from 12 to 4. And by the way, they don't eat lunch at all under that circumstance unless they're students in need. They get sent home for lunch. We also, though, expect more students in need and more needing free and reduced meals as unemployment rates rise. As I mentioned earlier, there has been legislation proposed to hopefully help in that area. But what we do expect is that those who can afford to opt out will do so, not only to not, mostly because of the elimination of some of the more popular items like food bars. Next in CNU, we talked about the fact that reopening is uncertain. So we'll see an investment in technology. More ordering ahead technology and delivery robots are definitely expected, as well as a much higher focus on grab and go or options that have a longer shelf life and travel better. Definitely expect less complexity on the menus than we've seen in CNU historically. And then creative ways to develop community. So steal ideas from restaurants. Restaurants are doing karaoke nights virtually. They're doing, trivia nights, things like that. So look at and see what kind of community things they're doing. There's a restaurant that did a Tiger King theme. If you dress as Tiger King when you pick up your food and you post that picture on Instagram, you can get a discount on the meal or an add-on to your meal, things like that. For healthcare, uncertainty certainly abounds in this segment. We know most still don't allow elective procedures, and overwhelming the healthcare system is a huge concern. Did we succeed in flattening the curve? We don't know. Eventually, they'll go back to business, but this is the one segment that really has the most uncertainty. So we expect in the near term, they'll continue to limit visitors, especially in restaurants and cafeterias on site. And we expect a much larger increase in single-serve packaging and disposables. So that brings us to our kind of final thoughts here. You're going to really need to work on building the consumer confidence. Hyper clean, they want to see constant wipe down of shared areas. Show that you can care for your employee well-being with lots of hand sanitizer and face masks. And the new Frictionless will be showing that you do this. Frictionless used to mean speed and convenience. Now Frictionless means instead of speed, that I feel safe. I feel safe and it's convenient for me to go there because I don't feel stressed when I go there. And then economically, a lot more concern there for people who've either had salaries cut or hours cut. So value positioning will help them feel better. It'll help their sense of well-being. And then consider more space between your tables and sanitizing wipes at the tables. Those are the two other big things consumers are asking for to feel comfortable with dine-in. I mentioned the new Frictionless, that the new convenience will be worry-free. You cannot underestimate the importance of that at this time. So it's not just about being fast anymore. They'll give up some speed in order to feel safe. And then finally, value positioning. You see people like Denny's doing family meals for $24.99. Look at items like that. It's going to require menu streamlining to be able to get costs in place and to reduce waste, which will help you improve costs as well. And then finally, rely on your partners. They have lots of best practices they can share, from menu ideas to waste reduction solutions, versatile ingredients. So there's an example here of dragon fruit bread. That was someone who had a lot of dragon fruit that they couldn't sell anymore, so they made bread instead. Bread was hard to come by. And so now people could come and get pink dragon fruit flavored bread, and it flew off the shelves. So, look to things like that. And then supply solutions. Does your distributor have extra chicken wings on hand because the bars are closed? See what kind of, wings they have for you. So that is it. I think we went right up to the time, but I want to make sure that we still have time if anybody can hang on for questions. So let me go to the question view here.
Thank you so much, Catherine. And Catherine, actually, if you have a second to switch it over to me, I have a few slides on the partner component that you just kind of wrapped up that we really want people to understand. how Gordon Food Service can be a partner in this space as well.
Yeah, and I think I just sent it to you, so hopefully you've got it there.
Perfect. Yep, I think I should be all set here. Yes, okay, perfect. So the first thing on the topic of cleaning, sanitizing, and disinfecting. So 3 words that are probably in your regular vocabulary always, and even more so at this time. Talk to your sales rep about our Array chemical line, along with some of our safe cleaning programs and resources related to safe kitchen guides. We want to make sure you're getting support on this side. Also want to showcase a couple of resources that are unique to the healthcare side. Staffing strategies related to COVID-19. So Catherine, you mentioned the labor shortage issue at hand. And so at Gordon Food Service, we put together some best practices in terms of strategies to help operators through those challenging times, along with unique infection control precautions that are relevant on the healthcare side, whether that comes down to changes with communal dining, changes with tray service delivery. We have some great resources on that topic. We have a consistency modified handbook, which, maybe initially it's kind of difficult to see how this fits in with everything. But think of it this way: if healthcare operators are getting new staff in, quickly getting new staff in, they need to be able to train them on things that are really unique to healthcare. And that's where this consistency modified handbook can come into play. A convenience menu, a 2-week cycle geared towards convenience type items, again, to help in that labor saving space, along with a couple coming soon resources that we're really excited about. Overall food service operation best practices. And that's going to give some ideas and best practices that will help you as you transition into this new normal, so to speak. Additionally, you mentioned this a couple times, Catherine, is kind of that pantry or market or micro market concept. So coming soon on Gordon Experience, directly available to you, will be micro market resources and also a quick podcast that will leave you inspired based on what other operators have done in that space. So these are accessible on Gordon Experience. We have a coronavirus action page where you can access all of those resources. On the K-12 side, a couple things, again, to highlight in that same location on our coronavirus action page. First one being that K-12 emergency menu. And, Catherine, you talked so much about the individually wrapped type items. This menu is based largely around those individually wrapped type items. And we're also working on expanding our menu solutions for back to school ideas, knowing that individually wrapped items may be more on the forefront with the menu than perhaps they were in the past. Additionally, just to make more resources more accessible, we link out to the CDC guidance for K-12 and higher ed, along with a couple FAQs on child nutrition programs. Future resources to help our education operators include best practices for the continuation of emergency feeding, and then also what may transition into that summer feeding, along with back to school success strategies. So we definitely encourage you to check those out, connect with your sales reps for more information on those. And also wanted to do a quick plug for some of our upcoming webinars and podcasts. So we have 2 webinars next week, one on safe kitchens focused on cleaning and disinfecting, and another one, portable and delicious, focused on menu design and food safety as it relates to grab and go or those portable type items, which, as Catherine mentioned, is something that, may very well be here to stay for a while. And additionally, that podcast on the micro market concept. So those are all accessible on gfs.com on our solution page under culinary and nutrition resources. And I do know that we're running a little bit over on time, Catherine, but if it's okay with you, I would like to just see if there are any questions.
Sure. Yeah, I can hang on.
All right, perfect. We do record this, so it's a great way just to make sure we cover anything that came in at this time. Let's just take a quick look here. One question that came through was specific to summer camps. If you've heard anything specific about summer camps overall in your research, Catherine.
Yeah, so we just started looking at that. The sense that we're getting is that most summer camp programs are on hold. What most YMCA's have canceled their summer camps. Um, so we expect that it's going to be a continuation of what we see now with kids at home for the summer, and with the schools themselves, the K through 12 schools, considering continuing the summer feeding.
Great, thank you. Let's see, another quick question here. I guess if you could give one piece of advice to a food service operator in order to prepare for the future, what would that advice be?
Wow, that's a that's a tough one. We're just one piece of advice. I don't know if I can say there's only one, because obviously you need to make sure you're aware of CDC guidelines and all that kind of thing. But what I would say the biggest thing is listen to your consumers, and we, as I mentioned, do a lot of consumer work, and what we're really seeing is lack of comfort with food service right now. There's pent-up demand. They want to go back, and they want to go back to routines, but they're just not comfortable doing so. So make sure you understand what's going to make them comfortable. Now, with K through 12, you might say, oh, the kids, they're not thinking about it. They want to come back. Well, older kids are thinking about it, but their parents are definitely thinking about it. So it applies to everyone on this call. Understand where most consumers' heads are at. Some consumers think the whole thing is overblown and there's nothing to worry about. But our research shows that the majority of consumers do not feel that way. And in order to feel comfortable, they need to see very visible signs of sanitation happening and clear communication of all the steps that you are doing. So think about that. Think about, everything from tape on the floor to distance people. Think about telling them how you're going to manage traffic flow and the number of people in there at a time. Tell them what you're doing for employees to ensure employees are safe, whether it's temperature taking at the beginning of every shift. Just make sure they're aware of all of the steps that you're taking, and take as many steps as you can. The more, the better, to make consumers feel comfortable going into your operation again.
That's great advice. It's kind of talking about just communicating all the efforts that you're going through to help, reinstill the confidence. So I love that.
Exactly.
That's great. Very good. Let's see, we'll do one other quick one here. So with all the shifts in menus and potentially a product mix to more individually wrapped or grab and go, what do you recommend? And I guess some of these you mentioned during the webinar, but what do you recommend as strategies for still creating that personal connection with guests, as we know that tends to influence guests and resident satisfaction?
Yeah, well, there's a few things you can do. Obviously, we talked about some of those things for healthcare, like putting little notes on there.
Yeah.
Things like that. Communicate, setting up meetings, virtual meetings where people can come together and talk over a screen. Even that really helps people's sense of connection. You see a lot of business teams are doing that. And however you can incorporate your food into that experience, whether they all get their food from your operation before they do it, or you just do it as a way to just keep that connection. Either way. But yeah, I would say those are some of the big things. And then another interesting thing that I heard someone talk about that I can share is the idea of letting your folks voice their opinion. What would they like to see? What would they like to see on the menu? Because you're probably going to need to reduce your menu for a while because of staffing issues or being difficult to forecast demand. You're going to want to reduce the number of varieties, but let them feel involved in the process of creating that menu and having a voice in what the variety that you can offer is.
I love that. I love giving them that voice, giving them that opportunity to potentially influence some of the menu changes that may be on the horizon.
Yep.
That's great. Well, thank you so much, Catherine. This was really valuable, filled with insight and, I think insight that allows us to think through the upcoming steps that are on the horizon. So I thank everybody who took time out of their day to attend today's webinar. As I mentioned, the continuing education certificates will be emailed out to all attendees tomorrow. If you do not get that for any reason, please just reach out to the Nutrition Resource Center at Gordon Food Service, which you can do so just by emailing nrc@gfs.com Catherine, thank you again so much for your time.
Thank you for having me.
All right. Take care, everyone.
Bye-bye.